Whether it's your first time here or your 38th time, I hope that over the next 3 days you're able to learn, gain insight, and also build connections with people.
Oh, it's been a great day. Best speakers, excellent educators, and then you get to network and see all of your friends again.
Honestly, I think this is one of the highest yield conferences that you can come to. You are going to leave this day with all sorts of clinical pearls in your pocket for your next shift.
This needs to be a sea change. If we can do this is something we can all take home to our departments tomorrow. It's just guideline-based care, not fancy evidence-based medicine care. If you can do this tomorrow, you will have healthier patients, you will have happier patients, you will have happier nurses, you will have happier doctors. Why the heck wouldn't you do this?
This is the biggest emergency medicine conference in all of the country. We had some amazing hands-on sessions, managing the airway, doing ultrasound, doing anesthesia blocks, and we had some excellent main stage speakers and some well-known emergency physicians and lecturers from across the country.
The world of emergency medicine and high-performance sport are really not that different.
So we're going to dive right in to pains in the back, spinal emergencies. I'm going to be talking about early pregnancy loss care in the emergency department.
Listen up, I'm gonna test your diagnostic acumen.
This is what you get when you invite an infectious disease doc up. It's like, what's new with gonorrhea? But there is stuff that's new with gonorrhea, and we see tons of gonorrhea.
It's very much about what you need to know on your next shift. And if you need to know how to suture, there's a session on suturing. How to intubate, there's a session on intubations. These workshops, you can't get in 600 people, 500 people. There are like 20 breakout sessions going on right now. And each of these breakouts, you get a choice of what you want to do. And they're amazingly small, they're high fidelity. Some of them are low fidelity, but they help you practice a skill that you need improvement on.
If you can just think about your most memorable, nerve-wracking resuscitation that you've ever led and how you felt in that moment. I know we all have those that we can really, really feel. I'm about to take you through mine.
I know that emergency medicine has been difficult the last few years. I think that's that much more important that we're able to be here for events like EMU.
This is literally a win-win-win-win-win. It's better for every single person in the emergency department. This one is so easy.
The conference is phenomenal. It's well attended, it's well run, it's practical, it's hands-on. There's not a year that goes by that I don't learn something that I can't take with me to my day-to-day practice.
If you're thinking of coming, come next year, you're not going to regret it.